isn't it just a Republican versus Democrat thing? Rich versus poor, the poor want free health care, and the rich want to cut taxes?
No, well, partly, I guess. But it's not that simple. The real problem, from what I've been learning, is that healthcare costs are starting to gobble up half the economy.
Aha! So we'll have to do rationing, right? Like death panels?
Stop it. Don't use that bullshit word death panels. There's no such thing.
Well, we just can't sit and do nothing. Everyone wants all the most expensive tests and the most expensive drugs. And demand is basically infinite. We can't just spend an infinite amount.
Yeah, geez.
Fine. Forget death panels. But the government shouldn't try to cover everything. Just the basics, like a safety net. If you want more than that, you should have to pay for it.
And if you can't afford it, you can't have it.
Right.
So that's how you want to ration healthcare. If you're rich, you get decent healthcare. If you're poor, you don't.
Sorry. I didn't... That's just the way it is. There's no healthcare in the Constitution.
That's the U.S. But Canada doesn't do it that way. They believe that everyone has the right to the same amount of healthcare.
Right. Single payer. Whatever that is.
I don't see how that can work.
With queues.
Queues?
It's... people have to get in line and wait. The people who have the most legitimate needs go to the front of the line.
Wow. Who decides that? How do they determine?
The medical experts develop rules. I don't know exactly. It's objective. Like if it's time sensitive.
Yeah, it's socialized medicine. I wouldn't want to be in a system like that, where the government decides when I get healthcare or not.
It's not socialized medicine. The doctors and hospitals are private. It's just single payer. It just means their government handles all the insurance and financing.
Well, and costs are... The problem in the U.S. is its fee for service. The more procedures a doctor orders, the more money they make. The incentives are all wrong.
Mm-hmm.
Sure.
We spend more per capita here on healthcare than any other country in the world. Like 18% of the whole economy.
Yeah, 18% of GDP. I think that's what I read.
Yeah. And not a single other developed country spends more than like 10 or 11%. And yet, they all have better health outcomes.
Jeez, 18%? That's like a fifth of the economy. That doesn't make any sense.
I think we shouldn't stop until we get universal coverage, like most countries.
Didn't Obamacare do that?
No, not nearly. Families who can't afford insurance, if you're unlucky and you get sick, you can't work. Or it wipes out all your savings.
But at least it forced insurance companies to cover people with pre-existing conditions.
I never really understood that one. If they're forced to lose money on those people, how is that even insurance? Sounds more like welfare.
It really is unbelievably complicated. I think that's why government has to manage it.
I don't know, maybe. I think of government, though, and I picture going to the DMV. Oh, I can't get that image out of my head. Is that what it's going to be like?
And, well, the bigger thing. I just don't like the general direction towards a mommy state.
Oh, great. Yeah, we should all fend for ourselves. No police, no safety. If you're old or you're sick, too bad.
I'm not saying there's no role for government. Just, where is the personal responsibility?
Well, but my grandmother would be dead if it wasn't for Medicaid.
Sure, I hear you. But it still doesn't mean that everyone has a constitutional right to as much...
Fine, healthcare is not a right that's defined in the Constitution. But it's just common sense. Don't you appreciate how crazy rich the United States is? Maybe 100 years ago we couldn't afford basic care for everyone, but now we can, easily. Where's our excuse?
Well, we'll see how we do when all the baby boomers go into retirement. I think their health care could bankrupt the country.